All right, hi guys. It's the IG live show again. So today we have a power woman, um, Dr. Heidi Waldorf, together with us, and I'm still waiting for her to log on. So yeah, all right. Yep, Dr. Heidi is on. So it's our pleasure to have Dr. Heidi over here because she's really prominent.
Hi
Hello,
there.
Heidi. How's it going? Good
Good.
morning.
Good
Happy
morning.
Passover.
Thank you. It's a
How,
time
how
of
was it?
renewal, which is
I
a good
know.
thing. We need that.
All right. Did you celebrate or did you do
Yes,
anything
we
this?
did. We did for Passover. We do something called a Seder, and we did a mini Seder, a dinner, but we did it by
Right.
Zoom. I'm very
Right.
proud of my dad. While a lot of people are saying that they're like dads and moms can't even figure out FaceTime, my
Yeah.
dad set up a Zoom meeting of family across 4 states and 2 time zones.
Holy smoke.
Shout
So,
out to Dad,
yeah,
Dr. Donald.
awesome.
Yay.
And how old is your dad?
My dad is 84 years young, and he worked
Wow.
50 years in dermatology.
Right.
He just retired in 2000, summer of 2016, after 50 years in derm.
Wow. Wow. Fantastic. And you always call him the Sherlock Holmes of dermatology,
That's what
right?
everybody did because his big area was general derm, the crazy, crazy rashes no one could figure out, the really high, like, diagnostic challenges. And he could figure stuff out when no one else could. And he still loves it. Loves it. My
Man.
friends will send me stuff, I send it off to him.
And now we know where all the genes come from, right?
Well, I'm lucky. I got them from both sides because dad's derm and my late mom was both an artist and a lawyer. And my mom's mom
Wow.
was an artist. So I have
Yeah.
that visual thing going. I should have known when I was in training and I was trying to listen to heart sounds for an
Right.
80 split. And all I
Right.
thought of was, wow, that's an interesting lesion over there.
Right.
And so my eyes are better than my ears.
Right, right. Fantastic. And your mom, she's an artist, the lawyer, and you think a lot about her, especially this time. Yeah, I saw your Instagram live earlier with Steve.
Yeah, I think, I'm very lucky to have had, to still have my dad. And, I had my mom for 44 years. And I look back at this because we're now in one of the most stressful times of all of our lives.
Right,
And I've had stress before. And I think I mentioned to you that one of the issues is loss of control here.
right,
And we all feel like, oh my God, we are so used to, especially those of us in medicine, are so used to having control of a situation. And
right,
when I had cancer at the same time as my mom had cancer, I went into this like military mode, like, okay, I know there are things to do, and you just do it, and you are like, okay, it's like you're in a suit of armor and you're just going. I think one of the problems here is that it's a constantly moving target with COVID. We are hearing different things.
right.
We don't have control over anything. Um,
Yes,
it was like when my mom had her cancer and she would try to really focus on, well, maybe if I can take these supplements, maybe if I can do this visualization.
right,
And it's very difficult because here also, we're not on the front lines, and even the people on the front lines don't have control.
right.
So one of the issues is we're all online looking at every piece of data on this. We're all on these big
Exactly.
WhatsApp lines going, oh, this
Right,
treatment, that treatment. Oh, we should do this. We shouldn't do this. And we're just trying our darndest to try to get a hold of this in our heads. The only thing
right.
I feel really good that I have some control over, and thankfully I was already at my dad's place
Hmm.
at the beginning of this because I had to renovation in my apartment in New York. So I have
Right,
become their infection control officer or infection control dictator.
right.
So I am determined to keep my dad and his lovely wife safe
Okay.
during this. And I feel like that's a blessing because it's something that I can do. They can see me, I can see them, and we can take care of each other.
Yeah, it's great. And how's he putting up? Is your dad
You know,
doing okay?
like me, I think I inherited my ants in the pants. Do you know the expression ants in your pants from
Yeah.
my dad? And since he retired, my dad and his wife have been traveling. You know, they'll go 4 continents in a year and they
Wow.
travel more than their home. So
Right.
this is a big change for them.
Right.
Look how you and I travel. And it's really different not to always have, okay, today I'm doing this, that I'm doing that. And
Right.
I wonder for you, like, I don't know about you, but I'm wondering, how is travel going to change? Are we going to start not feeling safe in the midst of a plane with so many people? Are we going to have to wear masks? What happens to my wine and food when I'm sitting on the
Exactly.
plane? That used to be my happy place.
Yeah, exactly. So like 9/11 changed how we actually uh, go through all these flights and everything. I think COVID-19 will be the same.
I think
Probably
you're
won't
right.
stop. Yeah.
An
So
excellent.
how's the situation in New York right now?
Well, I
It's
think
the epicenter, eh?
I think you know, we're in the epicenter. Luckily, we're in that bottom of New York, that point downstate of New
Right.
York. I'm about 20 miles right outside of Manhattan right now, and even my dad's tiny little town has 21 cases. Our
Oh my.
county has thousands, and I think it's up to 3 or 4 thousand cases just in our county. In
Right.
Manhattan, we all know. Um, I have so many friends who are either on the front line, or their kids who are interns, or their spouses. And it's scary because I feel like California and New York really jumped on this and took it seriously a lot faster than our country as a
Oh,
whole. And there are still
exactly.
states where they haven't put shelter in place laws. I think it's 4 or 5 states where it's business as usual. And
Wow.
that's part of this, the state rule of the US. So for
Right.
people who are not in the US who don't understand it, we have such a big country that when it was set up, because of the heterogeneity, the different sizes of states, the different populations, the different industries, every state has its own ability to rule, so to speak, that then the federal government is over. And the federal government can take over things like they've done during major wars.
Right.
But it's either used
Yes.
as an excuse or there's hesitancy. And then states, you have right now a situation where you have states like New York with our fabulous governor, Andrew Cuomo, saying, please, come on, we're a state. Don't make us
Right.
fight against other states. Help us.
Yeah.
And then
Yeah.
you have other states going, wow, no, we don't want you to control us.
Right.
And it makes it difficult to have some control over this virus.
Exactly, because you didn't have the full lockdown of the whole country. It was state by state. Even you studied in Pennsylvania, and Pennsylvania was a little bit much later, right?
You know what? Pennsylvania wasn't as much later as some, the whole Northeast, but Pennsylvania was later than I trained along. So I'm what we call a Northeast corridor girl, meaning the
Right.
train route. So I was born in Bethesda, Maryland, when my dad was at the NIH during, he did his
Right.
Vietnam wartime there.
Uh-huh.
And then we moved to New York, and then I grew up in New York. Then I went to college at Harvard in Boston, down to Penn for med
Yeah.
school and internship, back to Harvard for residency, then back to New York for fellowship. So I've been up and down this route. And the Northeast was pretty well affected by this more than other states. You know, Texas and Florida just made their shelter laws, and Idaho still hasn't. I mean, it's it's a little crazy.
It is crazy. It is crazy. Do you think that will actually drag the whole situation for much longer? And
I do think so, and I'm concerned about that.
Mhm.
And obviously, this is not the place to go through. And I try on my business sites on Instagram not to discuss politics, but
Right.
indeed, we had warning, and I think this could have been a lot better. We
Right.
had warning, and then we had warning again. So I just hope that we do actually get to we didn't necessarily flatten the curve, but if we can at least hopefully get over the peak faster now,
Yeah.
and who knows what's going to happen, whether we're going to have a second peak.
Yep. Yep. We will see. Here we have a lockdown, and we were supposed to lift it up next week, but we have a feeling if you just let it go like that, it will the second curve will come in, third curve, and fourth curve. It's gonna go forever. Yeah.
Exactly. And one of the problems is there's not widespread testing. So
Right.
initially there was almost no testing. And now a number of my friends who've clearly had COVID didn't even get the test because to go use up a test.
Right.
A lot of hospitals weren't even allowing doctors to get tests. I
Right.
know a friend's daughter who's an ICU nurse had a negative test, but then had
Right.
positive antibodies. So she clearly had a false negative. And
All
we
right.
also have so many people who are running around asymptomatic. So
Right.
I think it's going to take time. We are hoping, the federal government said, end of April. My office, we tentatively said, we'll open up May 4th, but it could be June. And we're
Right.
just rolling with it because we have to do what's best for the safety of
Yeah.
us, our
Yeah.
staff, our patients, and our community.
Exactly.
That's the key that I think people need to understand. I love there was a video about the Czech government's plan for everybody to wear masks, which really isn't a European or American thing. It's more of in Asia, it's a thing, and that has helped, and it helped Czechoslovakia. And the whole thing was, well, I'm protecting you, and you're protecting me.
Yeah.
And it's not just it's one for all and all for one. It's not just me.
Yeah. And your business, you still have your practice, you already closed it down for how many weeks?
We closed it. My first day closed was March 17th.
Right.
And I've been closed since. So we closed before there was the rule to close because, I realized there was no way to control. Once I heard there was asymptomatic spread, we could clean whatever we could, but what if aerosolized? You can't sanitize the air between patients. So the real question is going to be when we get back, what we need to start doing now is figuring out how we're going to keep everyone safe when we get back. Do we have we take everyone's temperature, but there are asymptomatic people? Does everyone who comes in wear a mask? Do they wear gloves? Do we remove all the pamphlets from our office? And all the books? Like I have a coffee table full of fun books that my patients love to read. We need to figure it out. And we also, the antibody tests are early. Do we know that they're going to be?
Yeah, exactly.
I think one of the projects that I'm hoping to work on with some colleagues is to try to figure out some standardized plans that we can follow so we're all not flying by the seat of our pants when this is over.
I think that is the biggest common questions among all of us, to how to go back to work safely, how to protect ourselves and our patients and our clients from getting the virus. So this I think we have so many Zoom calls these days talking about this. Everybody's trying to figure out. Any ideas from you? Like, what do you think will be the most important thing? Are we gonna be PPE all the time, or we kind of have to do like sanitize every now and then, every hour?
I think that the kinds of things, in a medical office, as I'm sure you did also, we all, were doing universal precautions. It's funny because I was talking to a number of my friends, and I'm 55. I graduated med school in 1990. So I started in 86. I have friends who started a little before me. We went through the beginning of AIDS and HIV. And it suddenly we were all talking that there weren't universal precautions before the early 80s. You went to dentists, they didn't wear gloves. So I think we're going to come to a new level at this point. There's going to have to be something additional. But look, we work on people's faces. The patient can't wear a mask while working on them. That sort of defeats the purpose. If we could figure out that'd be great. One of my friends, as I said on Instagram yesterday, a friend, Marina, was quoted saying, well, unless we had 6-foot needles, how are we going to do this? And I think that we'll have a better idea once we know how good the antibody tests are, how
Right.
long antibodies last. Because
Right.
remember, even vaccines don't last. I've had
Exactly.
my MMR, my measles booster
Right.
twice
Yeah.
because I didn't have antibodies anymore.
Yeah.
So,
And there have been reports people actually sort of recover from the COVID and then get the COVID again. So
we
yeah,
don't know.
we don't
And
know.
also,
Yeah, exactly.
is it mutating? So,
Yeah.
this is why I think it's so important that we lead with science, not politics.
Yeah.
And think about it. That's what we lead with our own jobs when we're talking aesthetics. We
Right.
don't
Yeah.
lead with politics. We lead with, okay, what makes sense? That's what we
Right.
do as physicians.
Right.
And that's what we really have to fall back on here.
True. True. And I think the whole Trump is trying to come out every day. I know today we don't want to talk too much of politics, but it is crazy. It is the insanity right now that we see happening in the States. Yeah.
There is, and I think again, it's the country's been so divided in since the last campaign, and never in my life have I watched news less than in the last 2 years or so, and then now starting again added a whole nother level of stress. And I know
Right.
I've been texting you in the wee hours of the night, and
Yes, exactly.
it's insomnia is a big thing now, and just trying to rip ourselves away from our phones, from the news. And I'm really trying to make a better effort at that now, because
Right.
our brains are just going. And
Exactly.
you know I
And you
know.
didn't get much sleep, yeah? Yeah,
No,
you that
I'm
yeah,
getting better.
sometimes like
I'm trying. I'm really trying, but it's been difficult.
right.
Yeah, it's been difficult, and working on it, working on it.
Yeah.
But I am doing yoga every day, almost every day. So that's
Oh
helping me
great.
keep the
Oh
body.
great. Yeah, ever since the last time you had a health issue, I think you kind of think that there's no point that there are things that we cannot control.
Right.
And we just have to let
I
it be
am
and
I would say that I'm an optimistic fatalist, meaning that I'm optimistic. I try to think about what can be positive, but I'm a fatalist because there are things we can't control. And I think that really came up. My mom, who was so healthy, had this bizarre cancer. She had no risk factors, mesothelioma, which was bizarre. No one smoked, no asbestos workers, no asbestos in the area, safety nuts. And then 6 months after that, I got breast cancer. And
mm,
it's bizarre. I mean, the whole thing was bizarre.
it's
And we have to understand that things happen. Now, this is beyond bizarre. This is surreal, and yet there's a harsh reality. So we are in this wacky area. What I'm trying to focus on, and a lot of my posts have been focusing on, is trying for us to be kind to ourselves,
yeah.
because you think, oh, okay, I'm home. I should be writing that great novel that's in my head, or I should
Yeah.
be updating all my paperwork.
Right.
I love this Instagram Live because it's social, and I feel like I'm doing something. And hopefully, if anything that we say resonates with someone else and can help them, then
Yeah.
it's a positive and
Exactly.
something I can do. Because,
Yeah.
I spent, I mean, much of the first 2 weeks curled in fetal position, worried about my business and everything else on a couch.
Right.
And I'm a pretty together person. I'm like that person you want with you in an emergency. You can figure stuff out. And
Yeah.
I decompensated.
Uh-huh.
And I feel like what really helped me was having, knowing that I could be here and focus on trying to make sure my family was okay.
Right.
Also, all of this interaction, all of the Zoom meetings, and the connecting with colleagues across the world, it's keeping connected. I think that concept of physical distance, but social connection.
Exactly. Well, we are actually more connected these days socially, so it's more physical distancing, right?
So I
So
have to tell you, I keep thinking, well, the first thing I want to do when this is over is, like, I want to travel to to go to a meeting and hug everybody. I just want to hug everyone. So if you see me at a
With
meeting,
the mask and the facial.
yes, I don't care if we need plastic between. We're hugging. I'm hugging all my friends, people.
I'm
Be
on.
prepared. Be prepared. I'm
Yeah.
tired of these air hugs.
Yes, yes. I think all of us, especially we've been seeing each other so frequently, and then now we're pretty much stuck here, but we still continue to stay online and to get connected. Yeah.
Now, and I think what's interesting is that we're so used to traveling, and one of the things that may well happen that's already happened is switching a lot of the meetings. Businesses are seeing that, and
Online.
I think even for us to virtual. Last year, I was part of the Global Virtual Aesthetic
Right.
Symposium, and that was
That, yeah.
really cool. And it was great because
GVAS, right?
GVAS, right?
Yeah, yeah.
GVAS was fantastic. Shout out to
Right. It
GVAS.
was.
And it was before all of this, and it even had a virtual exhibit hall. And I think we're going to see more of that. And on the one hand, I
Yeah.
think it's great. It's cost effective. It's going to be very important because we're all going to need time in our practices. You know,
Yes.
it's hard enough to balance seeing our patients, which is our primary job, and all of the
Right.
traveling we do to lecture.
Exactly.
So we need to be at home. You know, I was
Yeah.
hoping to be in Kuala Lumpur with you guys this summer, and hopefully now
Right.
2021.
Yeah.
But I think there's going to be a shift, and I wonder how that's going to change relationship building, and also a lot of the great ideas we get and
Right.
collaborations start not during the meeting but in the back of the lecture hall or over
Exactly.
dinner or
Exactly.
cocktails. Or it's not that we're like, oh, we're having fancy cocktails. It's like we're like, oh my god, you said that thing, it's so
Yes.
cool, because we're
Yeah.
totally nerds. We love this stuff.
It is a drinking brainstorming session.
It's true. We
Right,
think of
right.
things because we like thinking. What makes us KOLs, key opinion leaders, and experts is we like thinking outside the box.
Yes.
And again, it's a little crazy how much we love what we do.
Yeah.
But it's really fun and interesting. And the fact that we can apply that to our patients
Yeah.
and make them feel better about themselves and is tremendous. And I really am trying to look at, when we get back, that if we can
Right.
help our patients start feeling better about themselves as part of their healing, that
Right.
would be helpful. However, it is non-essential. And
Yeah.
it is horrible right now that there are still people across the world saying that they are they're being such great physicians and friends to patients by going to their homes. Well,
Oh
they're
my.
just
Yeah.
viral vectors.
Exactly. Exactly. And you just never know. You never know because they are asymptomatic people and you might get and you can actually bring it to others. Yeah.
It's
So
ridiculous.
it is
It's
ridiculous.
unethical, actually.
Right. So what do you think? We have a question earlier. So how are we going to set appointments for patients right after this? I think this whole thing won't stop until summer and maybe a bit longer. And maybe the restriction will be a bit looser, or they will start to say, yeah, let's go on business as usual. And
I
what
think business as usual from before, it's going to be business unusual with a new normal.
exactly. I totally agree with you. And what kind of strategy? What do you think that will change, and how would you adapt to it? What would you?
Well, in my practice, I've already have a low volume boutique practice. So
Okay.
I see one patient every 40 to 60 minutes.
Mm-hmm.
My nurses may be having a patient at the same time, but it's
Right.
unusual for us to have more than one patient in our waiting room, sometimes two, sometimes someone waiting for them. I think
Right.
we're not going to be having those people waiting.
Yeah.
I am lucky that I have my own building. Nobody else is. You don't have to go through an elevator. There are no other offices there.
Right.
I think, and I think that there's going to be more of that, of trying to space things apart,
Yeah.
especially in the beginning, even though there's going to be this stress that so many people want to come in.
Yes.
Um, I think that we are going to have a clear strategy before we go in.
Yeah.
Whether it is that there is a box of, that everybody gets a mask and gloves before they come.
Yeah. Sure.
And we, you know, and then a staff person with gloves and a mask takes their coat and puts it in the closet for them. I don't know, but these are
Yeah.
all the little details we have to figure out. We have a beverage
Exactly.
center. We have a little
Yes.
beverage snack center because I'm beverage snack person. We're in the US because of informed consent. We don't have any wine there, but we have every, you know, tea, coffee, hot chocolate, and fizzy juices and such, and water and snack bars. I don't know that we're going to be able to have that for patients to be able to access themselves, because what if
you don't want
something? And
you don't want them to touch and pass to the others. Yeah.
We're going to have
And
to
I
figure
think
that out.
yeah, and I think you got it right. I think one of the things that earlier we had a brainstorming talking about it, and I think limit the number of patients to certain numbers and keep the quality care at the same time, keep them safe. I think this is probably one of the things that it makes sense rather than doing a lot of extra things. We talk about testing everybody, but it's impossible to test everybody. We don't even test for certain surgeries sometimes. Even some, like you go to send some surgical implants and they don't test for HIV. So it's just
Well, because
crazy.
we have universal precautions. And we know it, you assume, so I think this is going to be a new universal precautions. We have to assume everyone has COVID right now. And that's
Yes.
what we did with HIV, was assuming that's what universal precautions was. And it's funny because I when all this came up, I remembered late 70s-ish, early 80s, my mom switched us to a dentist who wore gloves. That was a big deal. We had to find a dentist, and it was hard. Now it would be unfathomable that a dentist wouldn't be wearing gloves and a hygienist wouldn't wear gloves. There was in Derm, one of the first things you saw, the classic old picture, was a dentist or hygienist with herpetic whitlow, with herpes on their finger, because they stuck their finger in people's mouths without gloves. And now someone would go like, ew, who does that? So, I mean, I say this half kidding, but we're going to have to figure out what universal precautions means for this. Now, once we have a vaccine, it's going to be much better, because yes, there might be a few, like the flu, you know, you get the flu vaccine, people can still get a different flu, but hopefully if we can overall get a herd immunity. The big one question that a lot of memes have been made about is all these anti-vaxxers. Are they going to run to get this vaccine? Hello, people. You got to be consistent with your feelings. But yeah, so I think hopefully we're going to figure that out, because look, that's with the measles. The big problem was that people stopped getting vaccines.
And then you have So, but we don't know what's coming out, because coronavirus. Then you have another one. Then you have a hantavirus or anything just coming out. So, I think like you say, the universal precaution is one thing that we really have to start thinking about. But is your business affected? Now you close for so many days, and after we start, I know there will be still patients or your clients don't feel safe to come back.
Well, I think the key is the patients who came to us before came because of trust. Years ago, I mean, I didn't have a website till 2016, maybe 17. And my dad had been in practice 50 years. I joined in 95. I was both here in Rockland and at Mount Sinai at the same time. My dad and I both trained at amazing places. And there's people, when we ask, why do you come here? They always said it's trust. It's trust. And so the patients who trust us to do the right thing for them aesthetically, trust us to do the right thing for them medically, because we're doctors. It's funny. I have my little pet peeves. These are my patients. I know it's also generational, the client thing. Some of the younger docs also call people clients. My mother was a lawyer. She had clients. I have patients, and I'm a doctor. And I remember loving when people started calling me doc. The guys in my apartment building in the garage, hey doc. So a doctor should mean something. And I think people who relied on us for trusting us will trust us again. But that's why we have to really set a line and say, this is the standard of care and this is what we're going to do. And it's not going to be easy. Our surgery colleagues, it's even harder because they're going to need patients intubated and it's going to be difficult. So what's going to be the new standard for pre-op medical checkup? What's going to be the standard for us for what we're having patients do? I mean, look, we made changes when we realized dental work after the Carruthers study, Carruthers and Humphreys and Bezelny study about, you know, when did people get lumps and bumps? Well, for years, I injected people who had just had a flu vaccine that morning.
Right.
Hi, I see Neil Sadik. I'm saying hello. I see other people on there. Hello. Sorry, we're chatting. So I think we're going to have, you know, we're going to be adding additional safety guidelines. And I think our academies will be helpful. As KOLs, we're going to have to be helpful. And it's interesting. If anybody has, I see someone saying something about a broadcast as things that they think would be helpful, please DM us on Instagram to let us know, because I think more ideas. This is why I have one of the things I'm proudest of. It's like some people, I don't know, they're, you know, you might be well known for different things. I'm happy I can share my ideas, and anybody else who has ideas, I want us to be able to share them. We may not always agree, but it's good to bring those things up.
Exactly. The more ideas we have, and there's always great ideas we can pick, and I think it's all we can just combine all this and do something great. And of course, I think we, like you say, we're moving towards a new norm, and the new normal will be so different from what we have right now.
Right, but we've had new normals before.
Yeah.
You know, I'm a sci-fi junkie, and I'm waiting for Doctor Who to come in and fix this whole damn thing. And it's not happening. I'm sorry. I'm very upset about that. But no, but, you know, we know all of these crazy scenarios that have come up, and we just have to remain hopeful and know that if we all work together, wear your masks outside, people. You know, I saw guys working on the, you know, on the highway, and maybe in certain fields, it's for whatever reason, they can't wear a mask, but stay apart. Don't bring it home to your family, and take this seriously. And this isn't political. Please don't make this political. And I thank everybody, all the celebrities who are trying to do good with this by using their platforms to say, stay indoors. We're doing it too. Is helpful. And I just want to also shout out to my staff who I miss. And I can't wait till we bring our family back together again, our Waldorf Durham family. And also thank you to the healthcare workers on the front line, the grocery store folks, the pharmacy folks, the drivers of the trucks, the Amazon, the FedEx, all of our lifelines. And, you know, to the people who are unemployed, who don't have a business coming, we're going to come back. For the people who don't know, we just can send out our hugs and love and strength, and just pray that our governments can do something to help everyone.
Yeah. Talking about unemployment, I just met some of the doctors. They say they actually have to let their employees go.
Oh, no, we have had to. That's one of the reasons I was curled up in a ball crying, because that's not what you ever wanted to have to do. But, you know, we can do so much out of our own pockets. The problem is we've also put off, like, I would pay payroll before I pay my Amex bill. And Amex has been putting that off. The vendors have been amazing. Thank you to Allergan, to MERS, to Galderma, who have given us better terms. Big shout out to you guys. It's huge, because our overhead, people don't get it. Like, we have huge overhead because everything we do requires stuff we bring in. We have stuff in our offices that's going to expire. And and we need to be able to bring our staff back in. Hopefully, the payroll protection loans in the U.S. will be coming through. It took a while for a lot of us to get that in. So when then we can bring people back, because we're not bringing in anything. So it's been, that to me was heart-wrenching.
Right.
You know,
And I
and
think, yeah,
that was heart-wrenching, and we're all doing it, and we all, I mean, I love, my staff is amazing.
yeah,
I rely
yeah,
on them for everything, and my patients do, and you just want to be able to bring your team back. And we don't know when these things are happening. And then let's say we do this and that helps us, but then we don't get to go back. Then what's
yeah,
happening? At some point,
exactly.
everyone needs to
Yeah,
get paid and get going. Um,
exactly.
there's a special unemployment now in the US, which hopefully
Right,
will come through, you know, and
right,
again, I say hopefully because look, even with the federal government finally helping with PPE, they've been
right,
sending the wrong PPE to places, you know, hospitals getting pediatric
right.
masks or,
Yeah,
you know, or masks being ordered, being shifted somewhere else where they don't need them. So that happens. It's bureaucracy. And I just hope it doesn't keep up these other things. I know every country has their own specific issues, and we all have this overwhelming issue. And let's
exactly.
not forget the people who can't be with their loved ones as they're dying.
Yeah,
Young people, as well as the older people,
right.
dying. Um,
Without their families around.
right.
And
And even people who were just had nothing to do with COVID, who can't be with
right.
their families.
Mm.
Again, I feel very blessed that I'm here with my dad and his wife, and a shout out, big kisses. They are amazing. And this is so hard for them. They
Right.
can't be with others.
Yeah.
Last night, again, our Seder, just seeing the kids, the grandkids in different places.
Right.
My brother, shout out to my brother, yay, who grew a white beard. He said it was so he could look like Moses for us.
And I think what COVID-19 has bring to us is a reset. At the same time, it reveals a lot of human kindness. People around us, we start to see, like you say, all these companies that work closely with us, and this is a time that we all feel the kindness that show, and we are all in this together.
I agree. And I want to shout out also to the companies that have, can't do a full list, but companies have been donating products, even skincare products, to people on the front lines. Other
Right.
companies are making big donations to feed people, to help people. You know, individuals are doing that too. They're famous individuals as well as just well-to-do people and others. People are chipping in. And even on the smallest level, I find, you know, we're taking the time to say thank you at the grocery store. We're
Right.
going slower. I said on an Instagram discussion with Steve Diane yesterday, I think I've learned more patience,
Right.
you know, which is the last thing that I ever have. And I think we're learning these things, and the key is going to be to carry them with us. Unfortunately, at the same time as this crisis brings out the best in people, it brings out the worst also.
Right.
And I don't want people to get disheartened by that, but also don't get sucked into it. And
Exactly.
don't, after this, you know, think, oh, I'm going to go do my bargain basement, this, that, the other, and then skimp on results, skimp on other things. I'm trying to look at this as a positive now that as all of my tox is coming back, and I like a natural look, so I've always had movement, but
Right.
a lot more people. And people are getting worried. What's going to happen at the end? Are they starting from scratch?
Right.
No. First of all, we have long-lasting fillers. Tightening procedures and stuff last over time. And
Exactly.
so an extra 1 to 4 months is not the end of the world.
Right.
And personally, I do stuff, you know, much rarer because there are things that I shouldn't do to myself.
Yes.
So I have to wait till I see, you know, my friends. And even though I have friends nearby who could do stuff for me, like for COVID, I don't want to look like a Picasso painting. So you like to keep your same injectors. So and if they live far away, you're not going to see them regularly. Tox, actually, it's not a bad thing. We're all going to get back and see what our baseline is. Maybe it will help your injectors look at you fresh. I do think that I may be starting with some people who we won't have seen for a while and go back to, let's say, that step.
Yeah. And I think we share a lot of similarities.
Phone call. We use at the very beginning, you know, where we do like the glabella, then have them come back for the forehead and that kind of thing. So, you know what? Look at it like a science project and say, let's see. We won't be on autopilot. Hi, it's Luciano in Italy. Both of our good our
Right.
brother from
Oh,
another mother.
he's getting on this Saturday.
Oh, I'll have to watch. I can't wait.
Right.
He has been
Right.
keeping me amused, by the way. His daughter is his little
Oh
girl
yeah.
is adorable, and he has a cat. He has a Sphinx cat who really needs
Right.
Botox. Tobias, you need Botox. And his little girl has been making outfits for Tobias. And
Right.
that cat has the patience of a saint. We can all learn patience
Okay.
from Tobias, who is
Right.
letting Jada dress him up. So it's good. And
I
a
totally agree
shout
with you.
out
Yeah.
to teachers and homeschoolers. Hi Jada. Hi Jada.
Hello. Well, and all time's about out. I think we'll stay in touch. It's
Yes,
great to have you here.
it's great. And I
And
want to tell you, I looked back and saw some pictures of you posted as a
right,
baby. Oh my
right,
God. It's you. I see the face, and it shows. We keep features, and
right.
it's great. And also, I just it's such a pleasure, and I want you to know how much I appreciate you and everything you do for our field.
Thank you. Likewise. I will stay in touch. Hopefully, we'll see each other very soon. I'll
Yes,
give
and
you a
I'll see
big
you
hug.
around
We
the
need a
Easter
big
too.
hug.
Yes,
All
big
right.
hug, big hug.
Big hug. All right. See you
Bye,
soon.
bye, sweetie. Bye.
Bye. Cheers. Bye.